Commission. So welcome to you all. Could we have the roll call, please, Joseph?
Yes, good morning, everyone. Welcome to the December 13th Patient Protection Commission meeting. Going to quickly take roll call of the voting members to make sure we have quorum to get started today. So starting with Commissioner Jalen Behunin.
Present.
Thank you. Commissioner Walter Davis. We didn't hear you, Walter. I see you.
Present.
Thank you, sir. And then Commissioner Flo Khan, are you here? I think she did mention that she would be traveling, so she probably is unable to join today. Commissioner Marilyn Kirkpatrick.
Here.
Thank you. Commissioner Bethany Sexton.
Good morning here.
Thank you. Commissioner Wendy Simmons.
Yes, good morning, present.
Thank you, Wendy. And Chairman Khan.
Present.
Thank you. We do have quorum, Chair. Just to note for the record, Commissioner Andrea Peterson is absent and Commissioner Bio-Curry Winchell is absent. We will also mark Commissioner Flo Khan absent, excused at the time, but we do have a majority present. Really quickly, just moving to our non-voting ex officio members, want to indicate if they're present today, starting with Insurance Commissioner Scott Kipper.
Here.
Thank you, Scott. I believe we have Deputy Director Shannon Litz representing Department of Health and Human Services.
Here.
Thank you. Executive Officer Celestina Glover, excuse me.
Here.
Thank you. And Executive Director Russell Cook from Silver State Health Insurance Exchange.
Present.
Thank you. All right, we have a majority of members present. Dr. Khan, we can go ahead and move forward.
Thank you, Joseph. So the next item on the agenda is the public comment. Do we have anybody in person or online?
Thank you, Dr. Khan. So under this public comment period, those wishing to make any comments this morning, we'd ask that you raise your hand if joining by Teams on the computer. Also, if joining telephonically, please dial the phone number 775-321-6111. And when prompted, enter the meeting ID number 874-814-389#. If joining by phone, you can press *5 to raise your hand to indicate that you wish to make comments this morning. Persons making comments this morning, please state your name for the record, spelling your last name so that we can indicate that on the written minutes. You will have 2 minutes for each of your comments, and we have a few hands raised already. So starting with, I believe, Cheryl Morelli, please state your name and go ahead.
Morning, everyone. Cheryl Morelli. I'm a general pediatrician. I actually just moved here from Seattle. I'm with Intermountain Children's Health. And I wanted to give some public comment on the state bills that you're considering, that you're recommending. And first I wanted to start by thanking everybody in the state publicly who have been child advocates and providing child care for the kids in the state of Nevada. And then I wanted to voice really strong support for all 3 Senate bills, 29, 34, and 40. So children's health in the state of Nevada was recently summarized really well in a publication from UNLV Lindsay Institute, which I think a lot of you are familiar with already. And the state of children's health in Nevada ranks last or nearly last in a lot of the indicators, including overall well-being, clinical care, mental health treatment, medical reimbursement, and access to care. And while it's really multifactorial why that is, and it's going to take a multifactored approach to address it, we believe that the Senate bills proposed actually are going to go quite a long way in helping to address some of the barriers. Specifically, Senate Bill 34 will help to decrease administrative burden to practicing in the state. Senate Bill 29 improves reimbursement rates, which will really go quite a long way in helping to cover the cost of the evidence-based care for kids in the state. And then finally, Senate Bill 40 really increases opportunities to expand graduate medical education so that we can keep more physicians and other healthcare professionals in the state. And the state of Nevada has world-class dining, world-class sports and entertainment, and really there's no reason why it can't have world-class children's health as well. And I think that we've taken a huge step forward in committing to build a children's hospital in the state. And I just really want to thank all of you for the thoughtful approach to recommending these Senate bills to address improving children's health. And I guess I would like to close by saying children in any state, and this is true in the state of Nevada, represent about 20% of our population, but they are 100% of our future. And I think if we can really invest in kids, it is great for the state of Nevada and will really help the state to continue to thrive. So thank you for the opportunity to speak. And I look forward actually to meeting a lot of you, I hope, and working with you over the next couple of years as we build the Children's Hospital.
Thank you very much. Do we have anybody else?
Yes, Dr. Khan. Renee Ruiz, please go ahead and unmute yourself. And to clarify, each commenter has 3 minutes for public comment. So Renee, please go ahead.
Good morning. My name is Renee Ruiz. Last name is spelled R-U-I-Z. And I am a representative of National Nurses United, National Nurses Organizing Committee, California Nurses Association. We represent the interest of over 200,000 nurses across the country and 3,000 plus in the state of Nevada. Today, I'm coming to address the national compact licensure compacts that are in the bills that this commission has offered up to be heard in the legislature this session. And I'm going to particularly address the Nurses Licensure Compact. And first, I want to say that we are absolutely opposed to all licensure compacts, and in particular, the Nurses Licensure Compact. This has been something that we have been very clear about over the years as we represent the interest of actual bedside doing the work nurses. First of all, the state of Nevada does not have a nursing shortage. There are more than enough RN license holding persons in the state of Nevada to fill every open position and to even fill positions that are not yet open if a safe staffing regulation is adopted. Now, the problem is not about lack of RNs in the state. The problem is keeping nurses at the bedside. And one of the things that we know particularly, as study after study have shown, is that we've shown in evidence that we've presented at the legislature over many, many years, is that the main thing that keeps nurses at the bedside is safe staffing, is also lack of workplace violence, which is something nurses and healthcare workers face daily. If those problems are addressed, more nurses would be at the bedside. It is also about respect and dignity in the workplace and healthy benefits, healthy community, billing as other voices are heard at the bedside. And all of these things are the factors that actually keep nurses at the bedside. We know that states that that have adopted the safe staffing guidelines actually have nurses flooding back to the bedside. It is not about a nurses licensure compact. This would prove to water down the standards of nursing in the state. And we are absolutely opposed to this bill. And we do plan to take our opposition to the state and further if we need to. Thank you very much. Have a great weekend.
Thank you very much. You have
Thank
somebody
you.
else?
Yes, Dr. Khan, a couple more. Elizabeth Bickle, you can go ahead and unmute yourself. You have 3 minutes.
Good morning, everybody. My name is Elizabeth Bickle. My last name is spelled B as in boy, I-C-K-L-E. And I'm also here to speak about the nursing compact. I've been a nurse for a little over 18 years, and more than 15 of those years have been here in Nevada. The nursing compact is unnecessary. Nevada already has an endorsement process in place that nurses can work on a temporary license while their application for full endorsement is being processed. Temporary licenses are generally issued within 7 to 10 business days after the initial application, so that's a pretty rapid process already. Pardon me, and those temporary licenses are valid for up to 6 months. There are a lot of reasons why I'm concerned with compact licensure, but chief among them, and the one I wanted to really speak about today, involves the integrity of, pardon me, of our education and of our licensure here in Nevada. Limited or weak nursing licensing requirements jeopardize patient care. Many states don't require the 30 hours of continuing education, each renewal period, as Nevada does, and some states, such as Arizona, which happens to be a compact state, require absolutely none. In 2023, and I'm sure some of you are aware of this, but the Department of Health and Human Services launched a multi-state investigation to apprehend individuals engaged in a scheme to sell false and fraudulent nursing degree diplomas and transcripts. These diplomas and transcripts allowed those individuals to then sit for the National Nursing Board examination, NCLEX. The warrants were executed in Delaware, a compact state, New Jersey, a compact state, Florida, a compact state, Texas, yet another compact state, and New York. Nursing schools accredited by the Florida Board of Nursing sold credentials to over 7,600 people without those individuals ever having taken a class or completed a single clinical rotation. Of those 7,600 individuals, it's estimated that around 2,800 of them passed NCLEX, the nursing board examinations. Dozens of licenses have been revoked. Many states have investigations ongoing. These were 2,800 individuals who were able to get jobs as nurses despite having no education and no clinical experience. The purpose of a nursing license is to protect the public from harm by setting minimum qualifications and competencies for nurses. The failure of nursing boards to adequately protect the integrity of their licensure endangers the health and safety of patients, and frankly, it's an insult to the profession in nursing. Thank you.
Thank you very much.
Thank you. We have a hand raised from Mark Ellis. Please go ahead and unmute and state your name for the record.
For the record, my name is Mark Ellis. That's M-A-R-C, last name E-L-L-I-S. And I too am opposed to the Nurses Compact bill, and I'll get into that for a second. But I also am a little upset that I look at all these faces and I don't see a single face of labor on here other than us as guests. If you're going to have a true board, there should be labor on this board. I represent Communication Workers of America, Local 9413, and I'm an executive on the AFL-CIO. This Nurses Compact bill has been voted down repeatedly. Nevada doesn't want this. We're not ranked very high in very many things at all throughout the state, education amongst, on and on. We're ranked very high on nursing. What this Nursing Compact bill will do is lower the standard so that way lower qualified nurses can become nurses in the state of Nevada. We don't want lower qualified nurses. We don't want lower paid nurses. Only the hospitals, for-profit hospitals, want this. It's time that you start listening to the people and stop bringing this forward. Thank you.
Thank you very much. Do we have anyone else?
We have 3 more hands raised. Ariel, please go ahead and state your full name, spell your last name for the record. You have 3 minutes.
Oh. Good morning. My name is Ariel Hernandez. My last name is spelled Hernandez. I'm a regulatory policy specialist at National Nurses United. My comments will concern the recommendation that this commission approved in October for Nevada to develop hospital at home and emergency department in home Medicaid pilots. It was not clear from the September-October meetings what the process for authorizing this pilot would be, and we would like to know if the intent is for the pilot to proceed as a bill or some other way. NNU strongly opposes hospital at home as well as ED and home programs. These programs put patients in grave danger by allowing hospitals and other healthcare providers to treat patients at home for conditions that require acute inpatient level care. Hospital at home lowers standards of care by waiving numerous provider requirements and patient safety standards. If this hospital at home Medicaid pilot is anything like the CMS acute hospital care at home program, it will waive 24-hour on the premises nursing services. It will waive immediate availability of emergency response and instead allows delays up to 30 minutes, putting patients at risk. And rather than address the crisis of hospital closures, hospital at home allows the hospital and health IT industries to capture windfall savings in labor costs and overhead by providing bare bones care at inpatient level reimbursement rates. Emergency department and home programs pose similar dangers to patient safety by allowing 911 dispatch and paramedics to determine whether to transport patients to a hospital or deem a patient eligible to stay home. And while EMS personnel are valuable first responders, they lack the license and the expertise to make this kind of patient assessment. Only RNs and other licensed healthcare professionals who work in the emergency department should make such a determination. This is also an equity issue. Nevada should seek to expand, not reduce, access to quality in-person care for Medicaid patients and other disadvantaged communities. And for patients who are sick enough to be hospitalized, quality care means round-the-clock in-person care provided by nurses and other licensed healthcare professionals in regulated licensed facilities. Thank you.
Thank you very much. We have more.
Thank you. We have a caller with the last 4 digits of 0960. Go ahead and unmute yourself. I believe it's *6 to unmute yourself.
Hello, good morning. My name is Chris Gibson. Last name spelled as Gibson. This is regarding the compact state. There is a reason why we call the great state of Nevada home. The citizens of this state are not necessarily conformists. As a nurse of this state, I am voting against compact state. As a resident and practicing bedside nursing of this state, I take pride in upholding high standard nursing regulations and training requirements. Healthcare is a different ballgame. Therefore, practicing nurses need to keep up with our ever-changing healthcare. We are taking care of patients, human beings. There is no backspace or delete or take two options in this line of job. Compact states have less stringent licensing requirements than non-compact states. Some of them don't even require their nurses continuing education. With that being said, it can potentially impact the quality of care our patients will receive. I've worked with nurses who come from another state at bedside who struggled tremendously because according to them, the med-surg level patients we have are actually considered intermediate care level from where they came from. That to me is a red flag. There will be a huge impact on our state's healthcare system. The influx of travel nurses could impact the job market. There will be poor oversight of the state nursing boards, license verifications and tracking, and most importantly, coordinating disciplinary actions. This will also affect income generation for the state because nurses will be paying the licensing fees to the state where they originally obtained their nursing license. These nurses also pay taxes based on their primary state of residence. Essentially, I choose stringent nursing regulations and educations over convenience, high quality of care, full oversight by our state nursing boards, growing our own competent nursing professionals who will also pay licensing fees to our own state, decreased wage disparity, and lower costs to employers. Thank you.
Thank you. We have one more comment. Susan Priestman, please unmute yourself. You have 3 minutes.
Hello there. My name is Susan Priestman, Priestman, and I'm president of the Nevada PT Association. And I would just like to take a minute or two to clarify the difference between the physical therapy compact and actually all three therapy disciplines will be offering compacts for this legislative term: physical therapy, occupational therapy, and speech and language pathology. I can speak with authority on the physical therapy compact in that this is fundamentally different from some of the comments that I've heard about the nursing compact. So I wanted to advise the committee that we are really in a different boat than the nurses are. We do have a severe staffing crisis for the therapy disciplines in Nevada. We are ranked 50 out of 51 jurisdictions in terms of physical therapists per capita. So we do have a severe staffing shortage, particularly in rural and underserved areas. The standards for physical therapists in Nevada are appear to be much higher than what the nursing compact folks are talking about. Each physical therapist that practices under compact privilege must follow all of the rules and regulations for the Nevada physical therapy, including continuing education requirements. Therefore, patient safety will not be an issue. We also I also want to say that the PT Regulatory Board is bringing this bill, and the Physical Therapy Association supports it wholeheartedly, as do our members. One of the problems with a severe staffing shortage of a particular profession is that other professions move in to try to serve the needs of the community and do not have the doctorate level education, the training required to provide safe and effective care to those patients when they are not physical therapists. And lastly, I can say with good confidence that the Department of Defense is squarely in the physical therapy court in recommending compact privileges for this state. We have many spouses of military individuals that are physical therapists that would be able to practice with much more fluidity and less administrative burden if we could pass the physical therapy compact. And on my coalition calls with PT, OT, and speech, those associations are also firmly in agreement with compact privileges for their respective disciplines. Thanks very much.
Thank you, Susan. Appreciate your time this morning. If anyone else wishes to provide public comment, if you're joining by phone, please press *5 to raise your hand. If joining by computer, please raise your hand through the Teams platform. Dr. Khan, I'm not seeing any additional requests for public comment at this time.
Thank you very much, Joseph. We can move along with the next item on our agenda. Item number 3 is for possible action. Review and approve meeting minutes from October 18th, 2024. Do we have a motion to approve?
This is Walter Davis, Commissioner Davis. I make a motion to approve the minutes of October 18th.
Is there a second?
This is Wendy Simmons. I second.
Thank you. Any opposed? If none, the motion carries. Going to item number 4 is informational only update on the Commission's bill draft request submitted to the 83rd 2025 Legislature. So, Joseph, you want to move on with that one?
Yes, Dr. Khan, thank you. And thanks for joining everyone this morning. My name is Joseph Filippi, Executive Director for the Patient Protection Commission. So really, as Dr. Khan indicated, this is just an informational item to provide commissioners and representatives from the public today an update on the commission's 3 bill draft requests that have been proposed for the upcoming session. So as directed by Governor Lombardo's Executive Order 2024-002, the commission has spent the past several months reviewing available data and national best practices, looking at providing recommendations to address the healthcare workforce shortage our state has. All 3 of these bills impact healthcare workforce in some way. And so starting with the first of the 3, Senate Bill 40, to provide an overview, it would seek to improve the capacity and the size of the state's healthcare workforce, while also increasing access to care for Medicaid recipients specifically. The measure would establish a Medicaid healthcare workforce account that would also be administered by the Nevada Medicaid Division. The account would provide an opportunity for any funding that's allocated to the account. It would be a sustainable funding opportunity to support graduate medical education, residency, and fellowship programs. Also, funds could be utilized to support apprenticeship and programs and loan repayment programs in the state. And any dollars that the state allocates to this account would also be matched with federal Medicaid matching funds, which would provide a higher return on the state's investment for healthcare workforce initiatives. The next bill being proposed by the commission, Senate Bill 29. It's 3 sections here. So really this bill focuses on increasing provider reimbursement while incentivizing, for better quality of care and also considering the value of the taxpayer dollar. So Section 1 would require Nevada Medicaid to seek federal authority to establish an accountable care payment model that promotes high quality and coordinated primary care and also focuses on improving health outcomes and lowering costs overall. This would differ from Nevada's current healthcare payment approach, which predominantly rewards for the volume of services provided rather than their quality. And then Section 2 would increase Medicaid reimbursement rates by 5% for physicians and advanced practice registered nurses to meet the healthcare needs of Nevadans. Additionally, on top of the 5% increase, it would provide an additional 3% bonus payment for services that are provided by these provider types in rural communities. And additionally, it would provide another 3% bonus payment for providers who participate in the value-based payment models established by Nevada Medicaid. And lastly, Section 3 would require Nevada Medicaid to issue a survey each biennium to the providers who are enrolled with Medicaid, asking for their input on how to improve the Medicaid provider billing experience and also any recommendation providers have on increasing participation in Nevada Medicaid.
Joseph,
Yeah, sorry, go ahead, Dr. Khan. Yep.
on this item, the Medicaid reimbursement, I thought we had put in the language for all providers. This one says physicians and APRNs. Would that change at the Council Bureau or otherwise?
So to my recollection, Dr. Khan, it was discussed at prior meetings by the commission that, there is a need to increase provider reimbursement rates for not only physicians and APRNs, but other provider types as well. As we all know, and I believe, the state Medicaid division shared during our previous meetings, that there's definitely a big fiscal note associated with any increase for provider types. I think last session, these providers received a 5% increase, and that was $20 million or more that the state had to invest. And so I could be off on that number, but I just know that there's a big price tag with any rate increase. And so it would be up to the legislature if they wanted to discuss, adding additional provider types to either this bill or any other bill to increase provider rates. This bill specifically, I think we all agreed that, we're trying to increase the access to primary care through this specifically. And just knowing that, you know, physicians and APRNs are often leading those efforts as far as expanding primary care access. And so that's why I believe the commission previously decided to focus on physicians and APRNs through this. But if there's any additional discussion
No,
at the commission.
that answers my question.
Okay.
Go
So
ahead.
thank you. Moving on to the third bill being proposed by the commission. There's a few more slides related to this one, but this Senate Bill 34 seeks to reduce barriers for licensed healthcare providers to practice in Nevada by authorizing the state to enter into multiple licensure compacts. So as shown on this slide, the bill is over 100 pages long. So, but just breaking it up by sections here. In section 1, that would enact the physician assistant compact. Section 10 enacts the nurse licensure compact. Section 21 would enact the audiology and speech language pathology compact. Section 23 would enact the physical therapy compact. Section 26 would enact the occupational therapy compact. And then at the very end of the bill in section 40, it requires the Department of Health and Human Services to then conduct a study on the impacts each of these compact has on increasing access to care in Nevada communities. And then also asks that the department to submit a report to the commission and the legislature by 2026 with that information. Just wanted to indicate some benefits of licensure compacts. I know that we've discussed this in prior meetings, and there's much more information in the report that we're going to discuss later as well. But some key benefits to licensure compacts, you know, they support gainful employment of military personnel who move frequently between different states. They expedite the deployment of healthcare professionals in instances of public health emergencies. They create an accessible regulatory environment that support healthcare professional recruitment, and they also enhance access to healthcare services. Just a little bit more about compacts. You know, states, through licensure compacts, states establish uniform standards to lower barriers to multi-state practice while also preserving the state's Practice Act and initial licensure process. Licensure compacts, they also enhance public protection through a data system that allows member states to efficiently communicate licensure data, including disciplinary actions against licensees. So enacting licensure compacts support the recruitment of health professionals and also reduce administrative burdens. Really, to put a visual to each of these compacts, I just wanted to share the different compact maps from each of the compact websites. So this is the physician assistant compact, and as shown here, all the states that have orange color, they've currently enacted legislation and are part of the compact. Nevada, along with 3 other states, have legislation pending to also join the compact. So 13 states currently are in it, and 4 states are pending. Regarding the nursing licensure compact, 40 states and 2 territories are currently within the compact. And similar to Nevada, Michigan, and the District of Columbia are currently have legislation pending for this compact. The occupational therapy compact has 31 states currently in it, and legislation is currently pending in 3 states, including Nevada. And the audiology and speech language pathology compact has currently 33 states in it, and Nevada and New Jersey both have legislation pending to join that as well. And finally, the physical therapy compact has 38 states and 1 territory in the compact, and legislation is currently pending in 4 states, including Nevada. This table kind of summarizes the information shared on the maps, showing the compact in column 1, the number of states currently in it, and the different provider types that would be impacted by the licensure compact. With that, Chair Khan, I'll open it up for any questions, comments the commissioners have. And as indicated, this is just an informational item. So if there is any discussion regarding amendments or things of that nature, that's going to have to wait until a future meeting until we can have that properly agendized. But happy to answer any questions, comments now that you've all seen the actual bill language and everything. Any questions from commission members this morning?
No, hi, this is Commissioner Davis. I just wanted to, as you mentioned, we will have the follow-up discussions for anything at our next session and spend some time kind of going through the process of evaluating based on feedback that we're receiving, all those that's at the goal.
Yeah, Walter, so thank you for the question. Joseph Philippi for the record. So it was an oversight on my end, to be honest. I listed this item as informational and didn't consider the commission potentially having an opportunity to discuss taking an action on any of these. So as it stands right now, the bills have been submitted to the legislature. If depending on any feedback the commission receives, if there is any chance that the commission would want to discuss, proposing an amendment during session to change anything that's already been submitted, the commission's able to do that. It's just I would have to place that on the next agenda for January as an action item to then have the commission discuss, considering any possible amendments if that's something you'd like to pursue. And just for clarity, just because we receive feedback doesn't mean that the commission would need to propose any amendments. But if there is an interest from commission members to discuss amending a section of any of these bills, that is an opportunity as well.
Thank you.
Dr. Khan, I think you're muted.
Sorry, this is Dr. Khan for the record. Do we have the DAG here on the line?
Yes, I'm here on the line.
Yeah, so I have a over there. Thanks. So I have a question. My understanding, and I could be wrong, is that any further amendments or changes, even from the commission, have to be addressed at the legislative level when this is going to committee or otherwise? Or can we suggest amendments as a commission as a whole, and then it goes to the legislature?
Yeah, actually, Joseph probably knows the ins and outs of that better than even I do. But it's my understanding that even though there is certainly a role for the legislature to play, that you guys as a commission could still take formal recommendations or opinions, advice that you may want to submit to the legislature as they go through their process, which is why we will probably bring this back as an agendized item on the next agenda.
Okay, so that's helpful information. Any other commissioners have any questions? All right, seeing or hearing none, we can proceed to the next item on the agenda, which is back to Joseph. This is for possible action, review and approve semi-annual PPC report required per NRS 439918. Joseph?
Thank you, Dr. Khan. Again, for the record, Joseph Philippi, Executive Director. So as Dr. Khan stated, NRS 439.918, specifically Section 2A, requires the Patient Protection Commission to submit a report every 6 months to the governor and the legislature related to the meetings and activities of the commission during the preceding 6 months. The report must include, without limitation, a description of any issues identified as negatively impacting the quality, accessibility, or affordability of healthcare in the state, and then also provide recommendations for legislation, regulations, or other changes to policy and budgets to address those issues. Additionally, as directed by the governor's executive order, the commission has been focusing their attention on reviewing the available data and national best practices related to addressing the healthcare workforce shortage. So this report is meant to reflect the commission's activities over the past 6 months, and it does include 23 recommendations for the governor and the legislature to consider as the state approaches the upcoming legislation and beyond related to workforce. The report has been distributed to commissioners prior to today's meeting. It's also posted publicly on our website. And so if there's any questions or comments from commissioners at this time regarding that draft report, I'm happy to address those.
All right, so we open up for any questions, comments from the commissioners. I think this was, in fact, I know you had distributed to all the commissioners, and hopefully they've all gone through it. Yes,
Marilyn, I think your hand's raised. And press *6 to unmute. I don't think we can hear you, Marilyn. It says you were unmuted and now you're muted again.
Can you hear me now? Sorry.
Yes, we can. Thank you.
Okay. So I just wanted to say I thought that you did a good job of putting together a summary of everything that we discussed. We spent lots of hours talking urban versus rural versus fiscal impact versus how we could do things in the quickest time that would make the biggest difference and a long term. And I think you put together a pretty good report. I think it's probably going to be one of the better ones that the legislature and the governor's office has seen from the Patient Protection Board. So thank you.
Thank you, Marilyn. Appreciate
that.
that.
Wendy raised her hand.
Yes, thank you, Mr. Chair. I would like to echo what Marilyn said. It's nicely prepared. It's comprehensive. You even give us great references. You captured a lot of work that has gone in a very short period of time. And I just wanted to express appreciation, knowing that moving forward, there will be more work to do and more opportunities to represent. So thank you.
Thank you. Any other commissioners? So this is Dr. Khan. For the record, I think we have been very fortunate in having Joseph be with us as the executive director, and I mean it very seriously. I've worked with the commission for quite a while, so it's been a blessing, Joseph, that things are very efficient and moving, and there's a lot of interaction between you and all the commissioners to keep us posted and up to date with what's going on. So I certainly really appreciate your services.
Thanks, Dr. Khan. To be honest, the pleasure is mine, and it's been, as Wendy said, we've done a lot, I think, in the past few months, and so it's been a good opportunity to work with you all. And then, yeah, I'm glad that we got the bills submitted, the report finalized. Just appreciate all the feedback today.
Thank you. Any other comments?
So on that note, Mr. Chair, I know this is an action item, and I would like to move for a hearty approval of this nice report.
You have a second?
Yes, this is Marilyn. I'll second it.
Thank you. Any opposed? If none, the motion carries. Thank you very much. So we can move to the next item. Also for possible action, item number 6, discussion and approval of future meeting dates. So we can look at this. Joseph, you want to take it on from here? What is our load? According to that, we can decide how often we need to meet.
Yes, Dr. Khan, thank you again, Joseph Filippi, for the record. So this is just a proposed meeting schedule for the upcoming calendar year 2025. We currently have a meeting scheduled for January 17th on the books. Still finalizing that agenda, but I believe a majority of members have indicated that they'd be available that date. So that would be, I believe, the third Friday of the month, which it seems we've been kind of going either the second or third Friday of the month. So I guess, at this moment, I know that, a year ahead of time is sometimes difficult to pin down. It's kind of unknown as far as what your calendars will look like. But just wanting to get an idea of, we have been meeting monthly the past few months just to really try to get the bills finalized and to address the governor's executive order. I'm under the impression that it's, a lot of your schedules, as far as my schedule, might be a little more busy during session this next few months. But also, thought it would be helpful to meet at least one time during session. And so As this slide indicates, possibly having a meeting scheduled in April. Of course, we can still think of agenda items that we'd want to consider, but I'm assuming, the commission would want to have an update on where your bills are at that point in session, any updates regarding those and potentially other pieces of legislation that's related to the commission's scope. And then I was thinking meeting after session is over, potentially in late June or even maybe July. And then also, wanted to note that this commission historically has been meeting virtually. A lot of that I think was due to just the COVID era. But there is an opportunity for us to meet in person at least once over this next year. And all of you are eligible to receive travel reimbursement for any travel associated with attending these meetings. So you would be reimbursed for that. But so just any thoughts or comments regarding this proposed meeting schedule? Of course, we can always change it accordingly as time goes on.
It's Commissioner Davis. I support, the recommendation of the meetings that you have presented today, and especially like the opportunity to meet in person. I think that's a great idea. And where would that meeting be held if it's in person?
Joseph Philippi for the record. Commissioner Davis, that would still be up to the commission, really. I mean, I was thinking, most likely in Reno or Las Vegas. We kind of have an even split, I believe, at the moment of members that are up in the north versus the south. And so, but we could definitely, have a polling sent out and just some location ideas sent out as far as what would work best for a majority of the members. And then, of course, if there are members who are just, absolutely are unable to travel for any reason, we could still have a virtual option as well.
Thank you. And the reason for the question mark in April again is
I just,
for what purpose?
yeah, I just didn't know the commission's preference, Joseph Philippi for the record. I didn't know the commission's preference on as far as if we wanted to meet during session or postpone any meetings during session, if April was the better month to meet. I know that, May, especially May, but, even maybe sometime during April, the session starts to pick up a little bit. And so, but just wanted to kind of just open up the conversation and see what the thoughts were from the group.
Any other comments?
Thank you.
Joseph, this is Marilyn. I have a couple of thoughts. So, I think you should look at the calendar for first house passage, because there are some bills that have a fiscal impact and they'll for sure go to Ways and Means or Senate Finance. And so May would be extremely helpful at that point. But you might want to have something before first house passage because it's got to be added into the governor's budget or those type of things. We might want to make sure that we kind of know where it is, or I just think that it would be helpful. So the other committees I sit on, we try to meet. We meet in March, like every other week, and in April we meet once a week, but there's only 3 bills. But I just think maybe before first house passage, and I believe that's like the 1st of April or the last of March.
Okay, thank you, Commissioner Patrick. Any other thoughts?
Mr. Chair, this is Wendy. I agree completely with Marilyn. As a commission representing items that we brought forward and putting a lot of work on Joseph's and the team's part, it to be silent or not at least have a meeting to pull ourselves back together and see how things are progressing and where we might be more supportive if needed would have value. So I would suggest March.
Any other suggestions from commissioners?
This is Jalen Behanan. I'd just like to say I would really like to support the in-person meeting in August. I think that'd be great to get together in person.
Thank you. Anyone else?
This is also Bethany Sexton. I am supportive of all the thoughts that have been put on the table, including the in-person meeting. I think that could be really beneficial for us. And I would just offer in March is also spring break for people. So some people may be traveling or things like that. So if we can just try to be careful about the dates of scheduling if we do something in March as well.
Thank you. Any other thoughts? So if nobody else has a thought, I have a question, or not a question, a suggestion. So during the session, in our past experience with the commission, the legislature, there's a potential for the legislators to, or an interest of the commission to testify at the session, either to elaborate, explain, etc., on the bills. Should that come up, in the past, at least I remember as chair, I'd authorized the executive director to represent the commission at the session if so needed. Any thought by the other commissioners on that? Hearing none, then I think, Joseph, you don't have enough work to do anyway. So you can represent us if that comes up and they want some input from us. Or
Thank you,
if the
Dr.
committee feels we should give some input if it's not going the way we thought it should be going.
Thank you, Dr. Khan. Happy to do so, and I will definitely keep in contact with all commissioners throughout the process during session. I will notify you all of, upcoming hearings for our bills, and any, of course, proposed amendments that might come from other entities and things of that nature. I'll just continue to over communicate the best I can, and happy to address any questions, concerns that come up along the way.
As the session approaches, it may be a good idea to have an item on the agenda where you guys, of course, not just authorize Joseph to do that, but give him perhaps parameters, ideas, details, suggestions on his comments and his conduct with the legislature.
All
Thanks,
right.
Gabe. And just wanted to note that, as those hearings are scheduled, and, I'm assuming we'll have to present the bill to the committee. And so happy to, as you all indicated, we can discuss that at future meetings, how that will look, but happy to just, of course, share the presentation and the hearing date. And you all are welcome to come to those meetings. Obviously, the legislature is open to the public. Anyone can attend. And so we have time between now and then, but happy to discuss any of that going forward.
Thank you. So that's why I think, like the commissioners have indicated, a March meeting would be helpful. We would have some sense, and then we could give an additional direction, if at all needed, to Joseph going forward at that time. Any other comments or thoughts?
This is Marilyn. I just have one. So, Joseph, let me ask you this question. Are you going to at least be able, I don't know how it works with this commission, but are you going to at least be able to brief legislators, or are you just going to bring the bill out and then the hearing's the only time? Or we're going to be
Say that. Can you say that again, Marilyn? You kind of broke up. What did you say about the legislators?
Will you be able to brief them, or do you fall under the state agency thing where you don't necessarily brief them?
I mean, I am able to meet with legislators prior to a hearing to give, share information regarding the bill. I mean, I wouldn't be able to, of course, I would be speaking on the commission, so could only speak towards anything you all have discussed or determined during an open meeting regarding the legislation. But if any legislators ever want to meet with me, or even the chair, or any of you, honestly, regarding the bill, and just to receive more information regarding it, that's something that is okay to happen.
Well, I'm only asking because there's so many new legislators. 1/3 of them are new, and because we didn't do much with the Patient Protection Board, even for them to, understand the mission of what the board is and those type of things. But if you can go in and brief the proper committees beforehand, I think that's helpful.
I think
Understood.
that's a good point, Commissioner Kirkpatrick, given the new legislators that you mentioned. Any other thoughts from commissioners?
Bethany, please go ahead.
This is Bethany again. I just was curious. I know it sounds like Joseph will sort of be the one who will be presenting. Is there a need, or is it ever helpful to have commissioners as a part of that presentation, or is it typically coming from Joseph, and that type of administrative person?
So historically, at least since I've been in the commission since its creation, the executive director has been there to answer questions or talk to them. However, if a particular commissioner chooses, as Joseph alluded to earlier, or wants to be there, I don't think there is any objection to that. Is that correct, Gabriel?
I think that's correct. I think what becomes difficult is that as you guys, unless you're authorized by the commission to speak on behalf of the commission, you'd be speaking on behalf of your own opinions and your own interpretations and what you believe, was important. But if you guys have discussed and vote and agendize and say that this is what we want to meet on, have someone present, authorize someone to present speaking on behalf of the commission, that's certainly a possibility.
Okay,
right.
That's helpful.
Started out saying that and the commissioners in their individual capacity can always be there and communicate.
Yes, that's true. Absolutely.
Hearing or seeing none, we can move on to the next agenda item of public comment. Joseph, do we have anybody there?
So once again, Joseph Filippi for the record. Sorry, before we go to public comment, I just wanted to note, so the last item was to discuss the future meeting dates. I guess it sounds like a majority of you were in support of the at least proposed outline of the meeting months, other than maybe moving the meeting from April to March. I'll just take that feedback and plan the meetings accordingly, and I'll be sure to email all of you and make sure what meeting date works best in March and for the other months going forward. But okay, I'm just taking that feedback and thinking about it in real time. Thank you. So moving on to public comment. Anyone wishing to provide public comment today, if you're joining by phone, again, please press *5 to raise your hand. You may also raise your hand through the Teams platform. Each of you will have 3 minutes to provide your public comment this morning. Dr. Packham, please go ahead.
Good morning, Chair Khan and commissioners. I hadn't planned on providing public comment, and so I don't have prepared remarks, but I did want to comment on the licensure compacts and honestly, my frustration that there's any suggestion that we don't face a nursing shortage currently or for the next 5 to 10 years. That's not only incorrect, it's actually reckless in that it gives lawmakers a license to do nothing if there's no shortage. And so as you shepherd this Senate Bill 34 through the legislative process, my office is happy to provide information on the scope and severity of those shortages in nursing and the other fields covered by the compact bill, and happy to provide that to you and your executive director. So appreciate the opportunity to speak to that issue.
Oh, Dr. Peckham, thank you very much. For those commissioners who are not familiar, I'm sure everybody is, Dr. Peckham has been a part of this mission previously and has been very helpful in providing very specific information on subjects that are of interest for this commission. Dr. Peckham, thank you for all your help in the past and ongoing.
And then we have Renee Ruiz. Please go ahead. You have 3 minutes.
Joseph, could I ask one
Thank you.
question?
Again, my name is Renee Ruiz. It's
I'm sorry, Renee, sorry.
RUIZ.
Sorry, 1 second. Bethany, go ahead.
Could I just have Dr. Peckham state his credentials for the record, please?
Sure. John Packham, PhD, for what it's worth. And I'm Associate Dean at the UNR School of Medicine and co-director of the Nevada Health Workforce Research Center, also based at the School of Medicine. Thank you.
Thank you for putting that on the record. Sorry, apologies, Renee, please go ahead.
Thank you. My name is Renee Ruiz, RUIZ. I'm representative of National Nurses United, National Nurses Organizing Committee, California Nurses Association. I would like to address a bit about the National Nurses Licensure Compacts. The NLC does not do things just because they're trying to save humanity. It is a money-making institution, and much of that money is going to be drawn from the nurses in Nevada. So take that into consideration. The other thing is yes, we are a union, and we negotiate contracts with management. And when we do that, there is an end date to the contract. So we know that we're going to have to renegotiate, and management knows that they are going to have to renegotiate because there are things that we both feel need to be fixed along the way. However, when a state signs on to the Nurses Licensure Compact and other compacts, it is an ironclad contract that is virtually impossible to get out of. So when the state decides that this is not working, it is sucking money from the state, there is no renegotiation of the contract. It is, you are stuck with it for infinity. So that needs to be addressed. Again, I'm going to comment on the fact that there are currently enough RN licenses to fill every open position that is currently available. And if hospitals would adopt a state staffing guideline, all of those positions would be filled as well. We know that there will be a need for nurses in the state of Nevada and to continue to grow the nurses in that have licensure here in Nevada. And the way to do that is to improve working conditions like safe staffing guidelines, like health and benefits, like ending workplace violence, and further having a voice at the workplace that is heard. We have much research done on the Nurses Licensure Compact. We are more than willing to make that available for the commission. Further, if the commission decides along the way to withdraw support from a bill that is in play, they are more than able to do that. They're also, there is no reason why that the bill cannot be withdrawn if the commission so decides to actually put that forward as well. Thank you.
Thank you very much. Anyone else on the comments, Joseph?
Yes, Kathy Denauer, please go ahead.
Thank you. Kathy Denauer, for the record. I am the executive director for the Nevada State Board of Nursing, and I hadn't planned to speak, but I wanted to provide a little bit of public comment. One, I want to thank the Patient Protection Commission for being bold and going forward and supporting the Nurse Licensure Compact. I do want to correct some statements. The NLC does not generate any income. It doesn't generate any income for us. It is a licensure tool. That is it. It isn't going to solve the nursing shortage necessarily, but it will help. 40, as has been mentioned, 40 states and 2 territories have already enacted the Nurse Licensure Compact. In 2022, there was a survey conducted of Nevada nurses, and 92% of the nurses in Nevada stated they were in support of the Nurse Licensure Compact, including nurses that were part of existing unions. The Nurse Licensure Commission is made up of individuals from each state that has the compact, and there are discussions on a regular basis with regards to the nursing compact. It does not lower the standard of nursing care, and it would not lower the standards of care in our state, because there are uniform requirements for all compact states that they must follow those uniform requirements. That would be no different in the state of Nevada. So thank you for allowing me to speak.
Thank you, Kathy. We have a couple more comments. Valerie, please unmute yourself. You have 3 minutes.
Good morning, everyone. For the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. I just wanted to mention that along with all of the interstate licensure compacts, the board I serve, the Rural Regional Behavioral Health Policy Board, has also used its bill this legislative session to enter in the Nevada of Examiners for Social Workers into their newly formed Interstate Licensure Compact, the Social Work Compact. This bill is SB 68. We also have added additional language that would provide more detail to the requirements that each of the 4 behavioral health licensing boards are supposed to do annual data reports regarding their licensure. So just making sure that those reports are consistent, clear, and actually useful. If we're going to ask them to do additional work, we want it to be meaningful. If there's any questions about SB 68, please feel free reach out. Again, my name is Valerie Haskin. I know it says Quape there. That's my maiden name. For some reason, it keeps popping up, but I thank you for the opportunity to speak.
Thank you for the input. We have one more, Joseph.
We have Wendy Simmons, Commissioner. Did you have a comment?
Yes, thank you, Chairman Khan. First and foremost, I really appreciate when we have public comment. It just makes the meeting more rich. It brings ideas into the mix, and it gives us opportunity to have an understanding of our constituents, but also our program development people. And on that note, I'd like to extend appreciation to Dr. Packham for his longevity and his deep research that he has done over the years, and the privilege of witnessing how he pulls together data and information particular to Nevada. Dr. Packham, thank you. And secondly, to Kathy Denauer for her longevity in the role that she's been in, and her dedication and passion to quality for our nursing pools and nursing licensees in Nevada, one of which is my daughter. She's been a nurse at the VA hospital for 20 years. So Kathy, your dedication and your longevity speaks volumes, and I do want to thank you for that.
Thank you, Commissioner Wendy.
Elizabeth Bickle, please go ahead.
Hi. Thanks. For the record, my last name again is spelled B as in boy, I-C-K-L-E. I did want to respond just very briefly to what Kathy had said. Although in order to become a nurse in the United States, everybody does have to pass our board examinations, and those exams are standard across the states, which is why we are able to apply for licensure by endorsement. If I want to go work in California, I can apply for licensure by endorsement. I can do that in all 50 states in the US territories. So yes, there is the same barrier to practice, I guess is what I would call it. There's a certain standard we all have to meet. However, where I do take a little bit of exception with what she said is, as I pointed out, there are states that are compact states that do not hold nearly the same stringent standards for continuing education as we do here in Nevada. And it's one of the reasons why I'm very proud to be a nurse here in Nevada, is because we do hold our nurses to such high standards. The nurses I work with give excellent care to our patients. And I'm very, very proud of what we do here. I do not want to see that diluted by having nurses come in that are not held to nearly as high of a standard in continuing education as we are in order to maintain our licensure in this state. Thank you.
Thank you. If anyone else wishes to provide public comment this morning, please press *5 if joining by phone. If joining by computer, please raise your hand. Dr. Khan, I am not seeing any additional requests for public comment.
Okay, thank you very much. So that basically brings our agenda to an end. One last opportunity. Anybody has any comments before we adjourn? None? So,
Bethany, you had something to say?
Just would like to request that those that had offered to provide data and reports regarding some of the shortages or other studies, that if we could make requests to those groups to get those and have them at least as a part of our packet or whatnot for maybe one of our upcoming meetings.
Will do, Bethany. I will follow up with anyone who provided comment today and reference that they have data available to share. So we'll be sure to follow up. Thank you for that suggestion.
all right, thank you very much. So this has been, I think, if one of the shortest, if not the shortest meeting of this commission ever. So thank you very much for this efficiency of moving along. So until we hear from each other, happy holidays to everybody and a happy new year coming in.
Yes, happy holidays to you all. Thank you for everything.
Thank you very much.
Thanks,
Thank you.
everybody.